This exercise will be performed in two motion segments, first in L2, L3, then in L5, S1. In translaminar screw fixation, 4.5 mm Cortex screws normally are inserted into the lateral surface of the spinous process through the lamina and across the intervertebral joints. The screws are directed towards the caudal border of the base of the transverse process of the subjacent vertebra and lie in the caudal parts of the lamina and the base of the transverse process. The tips of the screws perforate the lower border of the base of the transverse process. This is the position of the first screw. The screw goes through the spinous process, the lamina, across the intervertebral joint, and traverses the base of the transverse process. This is the position of the opposite screw. The screw goes through the lamina, crosses the joint, and perforates the transverse process at its caudal base. One of these power drives is needed for this procedure. It also requires a long 3.2 mm drill, a 4.5 3.2 double drill guide, a depth gauge, and a large hexagonal screwdriver with sleeve. The 3.2 mm drill is placed on the lateral surface of the spinous process and aimed towards the caudal border of the base of the transverse process. Care is taken that the bone canal is created in the thick part of the lamina. A small tangential perforation of the lamina is of no importance. The depth of the canal is measured using the depth gauge. The small hook of the instrument may be used to feel for possible perforations of the bone canal towards the spinal canal. A 4.5 mm titanium self-tapping Cortex screw is inserted, but only to the point where the head lies against the spinous process. If the screw is tightened too firmly, it might fracture the spinous process. This is the final position of the first screw. The second screw is inserted in the same way. When drilling the canal, the position of the first screw must be taken into account. The second screw lies either cranially or caudally to the first. It's a good idea to already plan the position of the second screw when inserting the first. Therefore, the first screw is introduced slightly cranially or caudally to the ideal line to leave room for the second screw. The depth is measured. The second 4.5 mm screw is inserted, once again, only to the point where the head lies against the spinous process. This ends the L2, L3 translaminar screw fixation. At the L5, S1 level, the spinous process and the laminae are smaller, and the intervertebral joints may be oriented more sagittally. The drill is directed distally into the massa lateralis of the sacrum. The depth of the canal is measured. An appropriate 4.5 mm Cortex screw is inserted. The screw canal of the contralateral side is prepared. The drill is aimed towards the opposite massa lateralis of the sacrum. The length is measured and the screw is inserted. At the level of L5, S1, it's better to have the screws perforate the L5 lamina somewhat dorsally. Screws which are placed through the central part of the lamina could enter the spinal cord.